I've really tried to have clear messaging and create this culture of work and school and life comes first. 100%. The Canadian Public Health Hub and this mentorship program is just a nice thing on the side where you get to meet people and foster that passion that you have. But I don't want anybody to be stressed about it. And so really our only ask is that people connect once a month. If that looks like a 30-minute quick Google Meets, an hour and a half workshop that you all kind of like create together, it's totally up to the capacity of the triad themselves. Hello everyone, I'm Carly Berge, founder of the Canadian Public Health Hub, and you're listening to the Public Health Insight Podcast.
You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. So the juicy stuff.
Yes.
Canadian Public Health Hub.
Yeah.
Talk to me about that.
Sure. Yeah. I mean, honestly, it has a bit of a crazy origin story.
3 months? Turnaround time.
Right. Yeah. At the end of last year, I had been referred to an ophthalmologist. I had just been renewing my contact lens prescription. They noticed something weird in my imaging. And so I was sat down by the specialist and told that I had detached the retina in both of my eyes and was going blind. I had months before I couldn't see anything. I needed emergency surgery in 5 days' time. Yeah. And so when you're all bandaged up and bedbound for 23 hours a day, I had a lot of time to think. A lot of time to think. And for sure, it was like full days of just lying there thinking about my own successes, my failures, the impact I wanted to have in my career. And so I just started thinking of basically like, what's the next thing that I want to get excited about, especially in the field of public health. And reflecting on my failures, I actually had started a mentorship program in my hometown pairing grade 12 students with university students at UBC Okanagan. Did it for a couple years, had 200 students, but the students didn't show up. Like these high school students were not very responsible. They didn't come to the events. I hosted a pizza party, bought $500 worth of pizza, and 2 people showed up.
With your own money?
With my own money.
No, you didn't.
It's so bad. So that, I was like, you know what? I can't do this anymore. I love education. I love trying to make it accessible and bridging those gaps and making connections. And then I was thinking to myself, why can't I do that, use that failed model, but for public health students and early career professionals, and especially people that are going to be a little bit more responsible to show up. And especially as someone that was less experienced in my MPH cohort, it was a challenging and isolating process of trying to catch up and trying to start my career. And so I just really wanted to pay it forward to the next generation.
I was listening, but I'm in the back of my mind, I'm like going back to that eye surgery.
Right.
So hold on. So surgery in both eyes?
Both eyes, yeah. But at separate times, so.
So what that means is like sit in your room and just recover?
Lie down. Yeah, I had to be lying. So they injected gas bubbles in both eyes and they were like these black orbs I couldn't see through. So I had to have my head lying down for 23 hours a day. So it was literally just lying there, listening to lots of podcasts, lots of the Public Health Insight. Seriously,
I mean, I'm glad that you did, but hopefully not under those conditions. You know what I mean?
But it was
wow.
Yeah.
And then how many the time period from when that happened to when you were
3.5 months. Yeah, not allowed to work, not allowed to sit up, not allowed to walk, not allowed to grab things off the ground. But so many.
And instead of
positives
thinking about I'm gonna go on vacation, I'm gonna do this, you're thinking about
all the work.
I'm gonna go back to that my $500 worth of pizza mentorship program.
Exactly.
And I'm gonna do that again, but just for public health. That's what you were thinking about the 3.5 months?
100%.
23 hours a day.
Seriously, yeah.
Oh
No,
my
it was,
goodness.
It was crazy. But seriously, like public health PSA, get your eyes checked. Even if you do not wear glasses, make sure you're going to your optometrist every year or two, because I was going blind and had no clue.
That's
I didn't
wild.
notice. I didn't notice. I had been losing my periphery, but it was so slow I didn't notice it. But I've regained it. I'm fully good. I'm
That's
93% returned. But yeah, it was quite an
wild.
experience. Yeah.
That's wild. So yeah, moral of the story,
Get your
eye
eyes
health.
checked. Yes.
Eye health.
So important.
Wow. So now we have public health space, makes sense.
Mhm.
What were some of the components to this mentorship structure that you thought would be important for you? And I also imagine, too, given evidence-based frameworks and things like that, you're someone that would have also went into what are the best practices for mentorship. And
Right.
so even though we make fun about the $500 worth of pizza and things like that, you were at a very different point in your life when you did both. So
100%.
how was this time a bit different? And so you're thinking about things as you're recovering from the surgery, and then building that out is a different story. So talk to me a little bit about those different components.
Yeah. So, I mean, similar to the other mentorship program I had launched, I was following the format of, as I had talked about previously, like the Women in Science and Engineering mentorship program at UBC Okanagan. I got to participate in that as an undergraduate student. And so they had this kind of like triad where you have, a mentor at the top and two mentees, a senior mentee and a junior mentee, and they could kind of also learn from each other because they're at different kind of stages of their education. And so with high school students, couldn't really recreate that, but I had one mentor to two mentees, and they're going through the same thing at the same time. So you actually kind of have a peer, not just a mentor, but with the MPH Mentors program through the Canadian Public Health Hub, we have, of course, a mentor who's been there, done that, a few steps ahead of the students. They have an MPH themselves, or they've been working in the field for a year or two at the very least. And then we have two mentees under them. One is a senior mentee who is a current MPH student. And then we have a junior mentee who is a prospective student, someone that is thinking maybe an MPH is for me, or we don't want to make it solely for an MPH, because we've got Masters of Global Health and Masters of Health Administration, or even students that know that they just want to do a public health undergraduate degree and get in the workforce. We try to make it very inclusive, but yeah, kind of similarly using that model, but also turning it into trying to provide real world knowledge. So we host workshops every month. We have newsletters with resources that go out to the students each month so that they can really try to cultivate the conversation with their mentor of, maybe the theme of this month is imposter syndrome, and you want to talk about this cool TED Talk, and here's some tips, and has your mentor experienced it before? What were their tips starting their career? And then we also host monthly networking sessions. So you kind of have the mentors and the mentees in different triads interacting with one another, because we have over 100 people in this cohort, in this first cohort, which is so exciting to me. And yeah, just really wanting to like make it a free space that it's people just genuinely wanting to share their experience and share that with people a few steps behind them. And I just want to create an inclusive environment with that, keeping in mind that it's free for everybody.
So you launched, remind me again when you launched?
February. It was a little late because I was trying to I was starting work again and trying to get my ducks in a row with eyesight.
Right. And then when does the time period for a cohort?
Yeah. So they run for 6 months, and I'm planning to start a new one in June. So ideally it would be January start, and then another one, or rather July.
Right.
So every 6 months we'll have a cohort running. So we're going to open the next one for applications in June. And I've started kind of a wait list on the website, and lots of people are signing up. So I'm glad that there's such an interest, especially because, I felt it was a gap for myself, but I wasn't sure if it was just because I was one of those younger, less experienced students. But I'm very relieved that this is a gap for a lot of people. And we all want to create that space for each other, right?
There's definitely a gap for that, because one of the things and just to take a sidestep for a minute, one of the things I talk to current students about too is the fact that no single program, however good it is and however prestigious a school is, will sufficiently give you the job readiness that you need.
Exactly. Yeah.
It's just not going to happen. And so what do you do about that? So talk to people, learn about different skills you can develop outside the classrooms, yada, yada, yada. Yeah. And you're not going to have access to that knowledge unless you are in a space where people can maybe not spoon feed you, but like open your eyes, no pun intended to the eyes, I'm sorry, but to the range of possibilities, and people get a little bit more self-reliant, and then they kind of go about and do their own thing. So spaces like that, you can never have too many spaces like this, I find.
Yeah, thank you. Appreciate that.
So it's also a cool model in that when I initially learned about it, I got the sense that it would be like a longer time commitment for a mentor, for example, formally in the program. That tends to be a sticking point for a lot of mentorship programs. It's like, hey, I'm busy. I can't really be everything to this person for indefinite future. And so it seems like you have a structure, 6 months. The relationships that they cultivate can last beyond that, but you're no longer wrapping it around that cohort anymore. They're kind of off on their way, and it can connect as much as they need to going forward. Is there a reason you chose that specific model and that time period, and what was the thinking behind that?
Yeah, I mean, I find, especially because people are volunteering their time as part of this, and something, especially as someone that's volunteered a lot, thinking about those med school admissions committees, right? Hundreds of hours, but a lot of these organizations stress you out that you need to commit so much to them. And so I've really tried to have clear messaging and create this culture of work and school and life comes first. 100%. The Canadian Public Health Hub and this mentorship program is just a nice thing on the side where you get to meet people and foster that passion that you have. But I don't want anybody to be stressed about it. And so really our only ask is that people connect once a month. If that looks like a 30-minute quick Google Meets, an hour and a half workshop that you all kind of like create together, it's totally up to the capacity of the triad themselves. And I didn't have enough mentors, so I've stepped into the role for 3 different triads. So I have 6 mentees of my own, and they each have different needs, right? And so we have the mentor set up the first meeting, and then the mentees, it's up to them to set up the next ones, to send out that when to meet or that doodle poll, and figure out what kind of questions they want to ask the mentor. So really they're able to have the best understanding of their career journey and steer the conversation. And of course, we don't want to handhold, but we're trying to give resources and tools to try to cultivate that dialogue.
Yeah,
but
for sure.
Again, not wanting this to, like, this shouldn't be, I got to spend time on that mentorship program. No, this is a lovely thing that I hope stresses nobody out. And it's just this positive thing to come to when you need help, when you need a resource. Yeah.
And so, that piece, so I guess resources and coaching for mentees in how they engage because that's some mentees struggle with the kind of understanding that the world is bigger than. Anyway, I think you know what I'm going with that. So tell me a little bit about the breakdown of the numbers. So it sounds like you have more mentees in terms of ratio than you do mentors.
Correct.
And so if something could change from this point to going forward, you're looking for more mentors to volunteer. Is that a fair?
Correct. Yeah. And I think especially I was just putting out feelers if people were interested in this. And so I think a lot of the mentees that applied thought it was 100% like you're going to be accepted. And so when it turned into, but there's unfortunately only a certain amount of seats, I think it was unfortunately created a bit of a tone that left a lot of people disappointed of, you thought this was a guaranteed thing. So I'm trying to be a little bit more clear with the messaging for this next go round of I'd love to have around 100 people in this next cohort that'll start in July. And so really just making it clear of, okay, we need 33 mentors and 66 mentees or whatever that looks like. And we can't pair everybody. We'll do our best. Like people can still attend the workshops and the networking and have access to all of that. But maybe it looks like the next cohort that we can really try to fit them in.
here's the thing about it too is what I find anyway is as someone who LinkedIn is a very powerful tool to find people and connect. Sure.
It is. Yeah.
Now, people are going to be reaching out. You get it. I get it. People reach out to, and so
Right.
if you're committed to paying it forward,
Yeah.
it's probably easier to come into a more formal or semi-structured mentorship program than it is to then go through your LinkedIn messages and book meetings with people.
Right.
And so it's a good kind of hub for
Yep.
for that's exactly what you called it, to
Yeah.
facilitate those and have a little bit more structure that takes some of the burden off the mentor as well. So in terms of selling it, I put that out there to the ecosystem. I mean, I'm busy. I try to make space for, usually by referral. I have a friend like, hey, I told so-and-so about you. Do you have a minute to meet? And I am like, oh, okay. LinkedIn just became a little bit too overwhelming. So I stopped. Sorry, people.
Yeah.
But this Canadian Public Health Hub is a good space to have that kind of higher level coordination happen for you, essentially. And then you fall into place. So making that case for mentors to get a little bit more involved, and paying it forward is a huge part of public health. Like, think about the amount of people you spammed or took information meetings with. I think you really should think about how you might have benefited from that in many ways, and ask yourself if you feel like it's not tit for tat, but do you feel satisfied with the level of contribution that you paid back to the community for all that you've gotten from it too? I think it's a really important question to ask yourself too.
Yeah. Thank you for that, because we're trying to make it as simple and easy for the mentors, especially because they are putting a lot into this,
Right.
sharing their expertise, but recognizing it's only maybe 6 hours across 6 months. Like, that's not too much of a commitment. Hopefully your mentees are showing up. They're just really curious, interested in your experience, and just trying to kind of pick your brain of how they can follow a similar path. And we also try to make it really beneficial to the mentors too, with the workshops, and hopefully that they're relevant to them as well, so that they're not, if they want to attend, they're more than welcome. They do not have to. And that the networking sessions too, right? Of just appreciating that they're there, but maybe there's something they're there to provide expertise to their mentees, but maybe there's something they could learn from someone else too in our networking. But yeah, really appreciating how much they're putting in as mentors and trying to make it beneficial for them as well.
Okay. And where can people find more information about the Canadian Public Health Hub?
Yeah, we have a website, www.canadianpublichealthhub.ca.
We'll put a link in the description.
Yeah, thank you. Also on LinkedIn, we're on Instagram. But yeah, my messaging for everyone in the hub has been that it's okay if you're not where you want to be. You're not alone. This is such a vast but challenging field. And there's still things that you can do to be excited along the journey, to really try to enjoy that journey, not just the end outcome. So if anyone's interested in being a mentor, being mentored themselves, finding some cool free professional development spaces, I really encourage folks to check us out.
This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art design for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.